The issue about misdiagnosis or mistreated is that they are short-lasting attacks. They often come during the night, and the patient are desperate and walking up and down in their flat and can't sleep. But during the day, they may not have any attacks, and so people don't recognize it in the same way as if you can see something and if you are longer lasting. So you can have a miserable night with only 2 hours of sleep and a severe pain, but during the day, maybe not anything. So it's difficult for people to understand how severe it is. I just came from the clinic and said the severely affected patients, he said, I'm out of my mind when I have my attack. I don't know what I'm doing, and now I'm completely normal and can talk with you and so on. But if I'm in my attack, I can't remember anything. I'm just amnesic, and everything is blurred for me. I don't know. It's two different persons. Side of my personality. I feel schizophrenic and Dr. Jekyll and Mr. Hyde, and that's probably what many patients they feel, that they can't put words on how they feel, and if you haven't seen a cluster headache, it's so difficult to understand how it is. So what we do is also to give a proper diagnosis. If patients say, I have my normal migraine, I know that it's so and so or so, and I go into a dark room and take my tablets, and then I can come out later that night. But take a video, take a photo of yourself with your smartphone and show it to the doctor when you have the very severe, the different attacks. And that probably one of the reasons that it is misdiagnosed, because people in general and physicians in particular, they think that women have migraine and men have cluster headache. That's not necessarily so, and so it is so different, the phenotype of cluster headache. So, but patients are out of their mind when they have it and can't describe it in the same way. So a video from your spouse or your friend when you have an attack, that's really, really helpful. The other thing is that most of the cluster patients have an episode, that's called episodic cluster headache, and then it goes away, independent of what you do. You think it's your diet, it is the weather, it is the holiday, it is the stress, your job, your wife, whatever it is. But then it goes away, and then okay, it was what, and then they forget everything about it. And it's sort of a survival of your mind, that human nature, you tend to forget it, and then it goes on and on and on for years, and then 5 years later you get a proper diagnosis. So education, use the internet and use your phone to document it. Because many of our patients, they put the diagnosis themselves. So we do a lot of education. We do also to GPs, also to dentists, also to physiotherapists, to pharmacists, and tell what it is. So it's all quite often that it is one of these, and also general population, that they put the diagnosis. So we're down to 1 year now. Of course, it's long, but it's much less than it was in old days. So there's good help out there, the social media. I think it's important, again, for the diagnosis of cluster headache is that we classify headaches in the International Headache Classification, and we do not classify patients in self-hood. So patient can have both migraine, tension type headache, and a cluster or secondary one as well. So it is only classifying headaches, and patient can have both, and that's really important to give them both because the treatment is different, and especially women that have migraine can also have cluster headache. So two different aspects aside, it's not the same disease, two different, but there is a small overlap. That would be helpful to give this diagnosis, at least to ease the burden on the patient to know what they are having, because that's the first important step before we can give them a proper treatment. But there's a long way, further ahead of us. But I think we are on the right track, at least.